Hello and good day. I'm Dr. G.R. Vijay Kumar, Director of Neurosurgery and Spine at Fortis Hospital, Anandapur, Kolkata. Today I'm going to talk about technology in neurosurgery. Now, neurosurgery has always been a field that has required a high technology platform that has been since its very inception more than 125 years ago. The technology in neurosurgery has simply just got better and better as our computer speed and abilities have gotten better and better. So, what do we use high-end technology in neurosurgery for? For practically everything. Our diagnosis is with high-end technology like MRI scans, where increasingly artificial intelligence is being used for analyzing the scans, for creating different parameters for doing the scan. So we can do things like functional MRIs, we can do MR tractography. So these are all areas that help us in diagnosing and planning surgical approaches for, say, things like brain tumors or lesions in the brain. We also use technology for surgical navigation. So this is called stereotactic neurosurgery or computer navigation aided neurosurgery. This again helps us to do surgeries through smaller incisions, through a more focused approach where we can avoid critical areas of the brain. And this cuts out what we call the learning curve, particularly for young neurosurgeons for doing complex procedures in the brain. We also use robotics now, which are slowly coming in into neurosurgery. So robotics are currently used for spinal surgery mainly, where they are utilized for putting in pedicle screws. The robotic technology is still not fine enough or refined enough for doing complex neurosurgical procedures in the brain. They are being used for things like making lesions, for putting in ventriculoperitoneal shunts. But by and large, for standard neurosurgery like microsurgery for brain tumors or other complex conditions, robotics still will probably be taking another 10 years or so to come into common clinical application. But by and large, one of the fields in which high-end technology has traditionally always been used and will continue to be refined and developed over the course of the next decade, particularly with artificial intelligence and robotics, is going to be neurosurgery, because this is the field that is most challenging for surgeons and most scary for patients. Thank you.